My name is Dr. Luke Arnett. I'm a chiropractor and a kinesiologist in Dallas, Texas. I also have a product that I manufacture called Aloextra. In the product there is a formula called the Energy Formula, and we have been testing this product for an increase in strength using the Archon machine. This is a computerized program that tells us up to 1/10 of a pound what the particular muscle that we try to isolate out will pull from left side to right side. There are 3 consecutive pulls, 5 seconds each, with a 5-second rest in between. And from one side, and then we go to the other side. We give the patient either a placebo or the active ingredients of the Energy Formula and redo the test immediately. The machine produces a graph, and it shows either a average fatigue factor from the placebo, or a measurement that's showing no fatigue in the second half of the test with the product, or an increase in strength. And we normally have an increase of strength. Dustin, we're doing a functional capacity evaluation test with a Archon machine. It registers muscle contraction or strength that you can produce within a specific muscle that we're isolating out, up to 1/10 of a pound. The pull will last 5 seconds. I will have you rest at the end of those 5 seconds for a 5-second pull. There will be 3 separate pulls on each side. We will start with the left side. The elbow will remain straight with each one of the pulls, so you won't recruit anything else. Your pull will be in that direction, and that's it. At the end of each pull, you can rest for 5 seconds if you'd like. Probably would be best so you don't have fatigue. Do you have any knowledge of what the outcome should be of this test?
No.
Have you done this test before?
No.
Okay. Have you taken a product that is called the Energy Formula?
No.
All right. And pull. And rest. And pull. And rest. And pull. And rest. Remove the hand from the body so all the tests are the same. Body stays in the same position. Band, same here. And rest quickly. And pull. I have to redo that one. And pull. And rest. And pull. And rest. And pull. And rest. Okay. And we'll give the subject the product. Try not to move his position so it lays back in the same. All the tests are the same. And back down. We immediately go back to the other arm. And pull, and rest. Again, each time you're pulling the same, elbow straight, so all the test is the same. And pull, and rest. And pull, and rest. And pull, and rest, and pull, rest, and pull, and rest. And that completes the test. The computer will analyze it and compare it to the first set of tests. Okay. The data shows that his left arm on the first test pulled 11.2 pounds. His right arm, which he is right arm dominant, but it only pulled 10.8. As we expect, after 6 contractions, we have a fatigue factor. So the left arm, which was 11.2, now has gone to 10.4. So we did have a fatigue. On the right arm, which is occasionally happens with a dominant side, we actually had an increase, which means that the body become used to the contraction, it become educated, it had more repetition, whatever the case is. It went from 9.8 to 10.4, the same as the opposite side. Although it being a dominant side, it should be 10% stronger than the 11.2, which the left side was. By the way, the subject received the placebo in this, so there was no increase of strength over the left arm. There was an increase of strength in the right arm, even with the placebo. And Dustin's back with us today doing the same test, same machine, using the same muscles to see if we have any change in outcome. Again, Dustin, hold your elbow straight, have a complete strong pull, Patrick, if you go ahead and hit start and help Dustin get in position. And pull. And rest. Again, Patrick. And pull. Rest. And pull. And rest. And continue. Change sides. Straighten the band. Drop it down with wrist just a little bit. And pull. And rest. Up. It's fine. Put it back in position. And pull. And rest. Position. And pull. And rest. Go ahead and take the band off. Hit continue. And hit yes, continue. Okay, continue. Oop, up, right there. And the product is over there on the shelf. And we expect in most cases we have fatigue factor since we're doing 6 contractions. You will hit start, not continue. So Dustin, again, keep the elbow straight and pull as hard as you can. And rest. And pull. And rest. And pull. And rest. The graph actually shows a fatigue factor. The third pull is actually weaker than the first and the second. Hit continue, please. And pull. Rest. Pull. Rest. And pull. And rest. And that completes our test. Hit continue. Hit OK. Hit continue. Hit oops, bottom one. Hit quit. Yes. Report. The middle one down, right there. Yes. It'll come. Scroll down. Right there. It showed today his left arm was 10.3 pounds. His right arm was better than it was yesterday. It's 11.6. His left arm, after taking the product, went from 10.3 to 11.5. And his right arm, which was the weak one yesterday, went from 11.6 to 15.1. Is that 15 or 13?
It's 15.
15.1. So a considerable increase. Dustin, my question is, yesterday when you were doing the contractions on the right side because it was weaker, did you have pain?
Yes.
And did you have pain for the second part of yesterday?
Yes.
Did you have pain for the first part of today?
Yes.
Did you have pain for the second part of today?
No.
No?
No.
So were you surprised that the pain wasn't there?
Yes.
Are you surprised with the increase in strength?
Very much surprised.
So we went from 11.6 to 15.1 on the arm that had weakness and pain before we started. Yeah, that's huge. Would you do me a favor and sit up? Face the camera, okay? And tell us what you felt. Tell us if you felt the difference between the first and the second. I don't know. Some people feel the difference. Some people do not.
The pain was the main thing that went away. In yesterday's test, it was quite painful, and today's it was not as painful, but it was still hurting. And then after drinking the liquid, there was no pain.
Well, and I can see that you probably had less pain today than yesterday because you had more strength. You started out with more strength. Right. But even your strong arm increased in strength, which it did not yesterday. It actually decreased in strength because of fatigue.
Right.
So that's
it's amazing.
Yeah, it's amazing. So what did you think yesterday when you had a decrease in strength? Did you feel like that was normal?
That felt like normal fatigue to me.
And the second half of the test, you felt like just a normal test, just normal exercising. You started fatigue, just no change particularly.
No.
The second part of this, did you feel anything different? Was it easier to pull? Did you feel like there was more strength? Anything other than just the pain change?
Well, the reduction in pain allowed me to pull harder because it didn't hurt, and then also it was almost an increase in energy or awareness that came with the second part of the test.
Fantastic. Dustin, I thank you for coming in. Appreciate
Absolutely.
it.